All right, we'll go ahead and get started today on the Gallatin County COVID-19 press call. Today we have Lori Christenson, who's the Gallatin City-County Health Officer. We also have Kallie Kujawa, who's the Bozeman Health COVID-19 Incident Command Lead. And hopefully someone, a representative from Montana State University, will join as well for some updates and questions today. I'll pass it over to Lori.
Okay, thanks everyone. Thanks for joining our press call today. And again, my name is Lori Christenson. I'm the health officer for the Gallatin City-County Health Department. I'll start with our surveillance report. So the 7-day rolling average of daily cases per 100,000 was 63 per 100,000 as of 10/13. So this is the end of our epi curve that we're looking at right here in terms of the figure here. This is a 22% decrease from where we were last week. So we saw, again, a little dip, a little rise. I think it's too early to tell if this is going to be a sustained decrease. So we'll keep watching this, as we move into the coming week as well as the following. One thing I just want to reiterate and just share is I know in some places in the nation, there are case numbers that are declining, death rates are declining, hospitalizations are declining, and it's really too early here in Gallatin County to really, we're continued to be in high transmission. So we'll have to just continue to monitor this as we move forward. So we are not out of the woods yet here in terms of Gallatin County. So we need to continue to stay vigilant in our practices. And you'll see too, we continue to be higher than that 10% threshold in terms of our percent positivity. Again, while we saw a little decrease, we continue to be above this high 10% threshold. And moving on to the cases by vaccination status. Again, these are for Gallatin County specifically. And as you can see here, in terms of the number of cases that we're reporting, majority of them are among those who are unvaccinated. So that is this golden bar here, as well as in this blue bar indicates the unvaccinated. So we remain pretty steady in terms of the number of what we consider breakthrough cases. And we haven't seen much of a change in that percentage of breakthrough cases when we compare it to total cases. This figure here describes the number of hospitalizations for Gallatin County residents, again, by vaccination status. Again, the goldenrod color here is the number of individuals who are not vaccinated and hospitalized, and the blue indicates those who are vaccinated or what we would consider a breakthrough case and hospitalized. Again, the situation remains the same in terms of a majority of those individuals who are hospitalized are unvaccinated. Moving into our vaccination status, we did see about a 1% increase in most of our age groups for their first dose. And similarly, within the fully vaccinated, we saw about a 1% increase in most, not all of our age groups, and in most of our age groups. And I wanted to just share a little bit of information too. Over the course of the last few weeks, we have administered more boosters in Gallatin County than the first or second doses. And again, just as a reminder, we started administering those booster doses towards the last week of September. And we continue to offer those as well as first and second doses at the Bozeman Health Campus. And you can get your vaccinations in other locations throughout the county as well. So continue to vaccinate is the message for today. And these are our school data. And then I want to just again share that we continue to be in high community transmission. While it where people turn to the indoors more frequently with the weather turning, it remains really important that we continue to wear our face coverings, our masks in indoor settings, especially since we are experiencing high transmission. I'm going to stop sharing my screen. And I also just wanted to share with all of you, we'll get a follow-up press release as well from us. But we are saddened to announce 5 more Gallatin County residents have passed from complications due to COVID-19. One individual was a female who passed away in an assisted living facility. Another was a male in his 80s who passed away at an assisted living facility. And both of these individuals passed away the week of October 3rd. We just received the official death certificates this morning that attributed COVID-19 to their deaths. The 3 additional deaths have been identified through a routine reconciliation by the Montana Office of Vital Records. This is not unique to Gallatin County. This is statewide, this reconciliation. And 2 of those deaths occurred out of state, and 1 death certificate was updated to include COVID-19 as a attributing factor. We felt it was important to update and share this information with the community. With these latest deaths brings our total number of deaths to 78. With that, I will turn it over to Kallie.
Great, thank you so much, Lori. So currently we have no COVID-19 positive patients at Big Sky Medical Center. Our critical care unit at Deaconess Hospital has 20 beds and is currently at 90% capacity. 11 of the 18 patients in our critical care unit are COVID-19 positive, with the remainder being other healthcare needs. There are 5 COVID positive critical care patients being housed on our medical and surgical units. So although our critical care unit is housing 11 COVID-19 positive critical care patients, we actually have 16 COVID-19 positive critical care patients at Deaconess Hospital. Additionally, our medical unit is at 97% capacity and our surgical unit is at 125% capacity. It's really important to understand that our surgical unit has 18 medical unit overflow patients. So those are non-surgical patients on our surgical unit. In addition, our surgical unit has 2 critical care patients housed on their unit. In the month of September, all of the critically ill patients who were COVID-19 positive that required mechanical ventilation were unvaccinated. This information is in alignment with the latest science that proves that COVID-19 vaccines prevent severe illness. We're seeing that firsthand here. While we are still having very high numbers of hospitalized COVID-19 patients, we remain providing normal standards of care. Yesterday, the FDA unanimously approved the Moderna half-dose booster. The groups recommended for the Moderna booster are the same ones authorized for the Pfizer booster. And we anticipate starting to provide those Moderna boosters at our vaccine clinics as soon as the CDC authorizes us to do so. A CDC vaccine advisory committee is expected to vote on the FDA's proposal next week. If it recommends approval of the CDC and the CDC endorses it, we will incorporate Moderna booster shots immediately for eligible individuals who completed their immunizations at least 6 months prior to receiving their booster. That's really all that I have for today, but I am happy to answer questions.
Thanks, Kallie. Tracy.
I don't really have anything today, just here for questions.
Thanks. All right, with that, we'll turn it over for any questions. Go ahead, Sam.
Hi, I'm Sam Wilson with the Helena Independent Record. So Gallatin County, while you said you're not out of the woods in terms of overall cases. You know, on a like per capita is certainly doing a lot better than a lot of the more populated counties in Montana right now. I was just wondering if you might be able to comment a little bit on what Gallatin County might be doing differently, or kind of have going for it that's not the case elsewhere in some of the more populated counties in the state.
Sam, that is such a great question. And we've asked that of ourselves as we look at what's happening in the rest of the state. We've talked about it internally. I think there's just a lot of hypotheses that I wouldn't really be able to speak to anything in particular. I guess I'll turn it back to the continued need for the community to recognize the importance of continuing to receive their vaccination, continuing to test when they're sick, and continuing to seek the care they need when they aren't feeling well, so we can prevent those severe outcomes in terms of hospitalization if they do test positive for COVID. I really, like I said, I would be theorizing, and I don't want to do that. I don't really have anything else I can add more to than what I just said. You know, it's probably not the answer you're looking for, but that's the best I can do.
No, I appreciate that. And I mean, one thing that I've noticed is that Gallatin County does have a higher rate of vaccination than a lot of other parts of the state. And I'm kind of curious what seems to be working for you guys in getting more people to get the vaccine. You know, I mean, when you're, especially at this point, when a lot of people have kind of made up their mind, I mean, what kind of messages are working to get people to get the vaccine at this point?
Yeah, and I would open it up to Kallie to chime in too if she has other thoughts on this, but I'll start. You know, I think the most important thing that we've recognized and noticed throughout this pandemic is making vaccine accessible and available and easy to find, and continuing to message as frequently as we can and as many avenues as we can, the safety and the effectiveness of the vaccines. I think that is, you know, one of the ideas that we continue to explore is how can we continue to reach different population groups that maybe haven't chosen at this point in time to receive a vaccine. Who are we missing? For us, it's a daily question to try and assure that we are reaching everyone we possibly can. And we are, you know, when we look at Missoula County, you know, they're leading the state. We are kind of in that top four in terms of the number of vaccinations, and I'm grateful that we're there. I want us to continue to provide and continue to see more individuals in the county be fully vaccinated. Kallie, do you have anything to add?
No, I think access has a lot to do with it, but I also think we've had such a strong collaborative, coordinated approach with our health department. We've really partnered on making that a community coordinated effort with the largest vaccine providers in the community. And I think that has been a success for us overall.
And maybe what I would add to that too, Sam, is we also really early on really focused on some of our outlying or furthest reaching communities down in West Yellowstone. And they really did a tremendous job in terms of making sure that their residents had access to the vaccine, and we're continually trying, you know, different outreach methods in their community to ensure that individuals knew that there were vaccines available. They held multiple clinics. And I think the success is in communities sort of identifying specifically what's going to work for them. And then for us as a health and a public health system and healthcare system to make sure we're getting the resources to those communities. So I can't say that that's not what's happening in others, but I can just speak to what we've really tried to focus on in terms of our vaccination outreach.
Gotcha. I think that's all I got. Thank you very much.
Yeah, thanks, Sam, for the question. Other questions out there today?
Hey guys, I had a couple questions. I wanted to clarify, Lori, when you said you administered more booster shots than first or second doses. I'm assuming you mean just for the Pfizer vaccine?
Yeah, thank you for that clarification. Yes, for Pfizer, because that's the only one that is currently approved.
Okay. Okay, I don't know. That's good to know. And then I was also wondering, because it's been a couple of months or a month, I don't know, if contact tracing efforts have improved at all, if you've been able to, find more people and kind of get more of a handle on cases or case investigations.
Sure, absolutely. Great question. Thanks for that. We continue to look at ways to streamline, to maximize the amount of staff that we have available to us for contact tracing. It's basically, we look at it from a continuous improvement perspective. How can we continue to make sure we're hitting those priority cases? How can we continue to make sure that those individuals who have tested positive have all the information they need? And I would say that we continue to see improvements. Just this morning, I was talking to our contact tracing team, and they shared that and we typically see a little bit of a decline in terms of the volume of cases we see towards the end of the week, but we were able to connect with all of the cases we had yesterday, which was a great success for our team. And we continue to make sure that as we're looking at those prioritization and as we're looking at our staffing levels, we continue to innovate. We continue to think outside the box in terms of how can we make sure we're supporting our community so they have the information they need as quickly as they can. Does that help answer your question?
Yeah, I think so. Do you have any marker of how backlogged you guys are with cases, or are you still, I know you're doing a prioritizing, but yeah.
No, at the end of the day, we want to make sure we're getting through all of our prioritized cases. And that's why we set up that prioritization as well as, the prioritization of close contacts. And at this point in time, we still have that prioritization process in place. So we've not made any adjustments in order to really, be able to meet the need with the resources we have available.
Awesome. And then Kallie, I had a question for you about the hospitalizations. You mentioned all of them from September were unvaccinated. Do you have the total number of all the hospitalizations from September?
Yeah, let me clarify that. I may have misstated. All of the COVID-19 positive patients who were critically ill and required mechanical ventilation were unvaccinated.
That's right. You did say that. I just glossed over that in my question. Would you happen to know though how many patients that is or was?
I don't have the exact counts in front of me. But I think we can, if you inquire through Lauren, we can perhaps respond to that.
Cool. Thank you. Those are my questions.
Thanks, Juliana. Other questions this afternoon?
Hello,
Hi,
y'all.
John.
Happy Friday. I'm just wondering, have you guys had any clarification in terms of the H2B 702? I think we've talked about this in the past, but I was just curious if there's been any updates there in terms of how that is working in the state versus the federal conflict.
When you say HB 702, you're talking about House Bill 702
Yeah.
as it relates to vaccination passports.
Yep. And just in terms of large employees, like we're looking at Big Sky, for example, right now at some of the larger employers in the county, and specifically in our community that have over 100. And just curious because OSHA has not released an effective date for the private sector, I think. I know healthcare is kind of in its own realm there. So I was just curious if what that looks like for Bozeman Health, maybe in particular.
Yeah, that's we want to all know that answer and how the state and the federal rules will interact with one another. We've been involved in phone calls and discussions, and we really don't have a lot of clarity in what that will look like. So we are anxiously awaiting the final mandates that come down to us from the Centers for Medicare and Medicaid as conditions of participation with them. And are really just looking for the specifics of those rules. And we don't have any more clarity than you do, unfortunately.
Yeah, I was just curious if maybe you had a date yet, but it sounds like not. It sounds like the federal government is mandating on November 22nd for federal employees, but still nothing privately. So thanks, that's all I was curious about.
Thanks, John. Other questions out there today? Okay, well, thank you again for joining us on this Friday afternoon. We appreciate the time, and your questions are good questions and we appreciate them. So thank you for those. We'll continue to be available and wish you all a very safe and healthy weekend, and we'll see you next week. Thank you.